Hi everyone, my name is Isaac Hernandez and I'm the Spinal Cord Injury Fellowship Program Director here at McGovern Medical School in Houston, Texas. The following slides are meant to provide you with some additional information about our program in preparation for interviewing or in general. We're in Houston, Texas, and this is the Texas Medical Center where you will be spending your fellowship at. We will briefly talk about our team, the program, clinical, education, updates, and miscellaneous. Our leadership team, Dr. Francisco, our chair, Dr. Frontera, vice chair of education, myself, Dr. Davis, former program director, now associate director, and Kathy Brown, our program coordinator, who you likely have been in touch with already. This slide does not include all of the faculty members combined between UTHealth and Baylor College of Medicine. There's actually more, but this is just a portion of the providers that you would be working with in different capacities and that make the bulk of the clinical experience and academic experience that you would have while here. We're a one-year program, ACGME accredited, and our primary rotation sites are TIER Memorial Hermann, our home base, Memorial Hermann Texas Medical Center, our level 1 trauma center, the UT Professional Building where some of our clinics take place, and the Michael E. DeBakey VA Medical Center. On the clinical side, as I mentioned a minute ago, the largest level 1 trauma center here in the city, very robust PM&R consult service, additionally an inpatient rehab unit of 15 beds. Your role as a fellow has more to do with supporting the consult service exclusively for SCI related consults. There is no direct involvement with the inpatient rehab unit there. While here at TIER Memorial Hermann, spending a total of at least 4 months on the inpatient side. As you can see, over 100 beds, a 1-to-1 faculty to fellow ratio, always with a resident, often with a medical student. There are 2 SCI services, combined anywhere between 20 to 35 patients. That includes management of mechanical ventilation, pressure ulcers, diaphragmatic pacers, and phrenic nerve stimulation, ITP pumps. SCI PEDS exposure definitely available through the pediatric inpatient service, which is available at TIER as well. And as you can see here, some numbers in terms of exposure to vent patients. I will highlight that we do our own vent management. We do have pulmonary available, but it's more for procedures such as bronch and thoracentesis. I currently have 1 patient on mechanical ventilation. I believe Dr. Davis has 2. So there's a constant number of vent patients coming our way for great clinical exposure. On the outpatient side of things, here at primarily here at TIER, of course, working with spinal cord injury patients, both new and chronic, with our outpatient faculty, working on spasticity, spearheaded by Dr. Koropulu, one of the very few spinal cord injury trained providers in the country that does aggressive interventional spasticity management that includes botulinum toxin and phenol, as well as recommendations for ITB pump trials and implantations. Exposure to urodynamic studies, both through Dr. Stampas, physiatrist doing research, and our urology team. Again, intrathecal vacuum pump exposure, musculoskeletal procedure exposure, working with spina bifida clinics, and others that have been added recently, not necessarily all here at TIER, but ability to attend neuroradiology clinic, attend spine surgery clinic, spend time with a lower motor neuron bowel expert, etc. Some statistics about who we are. Now, as it relates to the rotation schedule, there have been changes that took place last year and carried over to this year, and by that I mean we used to have 2 months of electives, now we have 3. We used to have 4 months of time spent at the VA, now we have 3. In terms of procedures, ACGME doesn't have a specific requirement, but certainly the volume to be exposed to SCI-specific procedures is there. specifically as it relates to spasticity management with phenol, with botulinum toxin, as well as intrathecal baclofen. There is the additional option if you're interested in refreshing your skills or maintaining fresher skills, for instance, for intra-articular injections with our musculoskeletal expert to further provide help for your patients in the future. That's certainly an option. Additionally, the option to scrub in to observe different procedures that may come up along the course of the year, such as flabs, peg placement, urodynamics, electroejaculation, hand surgery, phrenic nerve stimulator, implantation when appropriate, etc. So furthermore, related to education, we revamped last year, I want to say with a lot of success, our didactic approach, where we're doing virtual lectures every other week on Wednesdays at 11:30. Rather than it being a lecture per se with passive learning, we've transformed it into a conversation and a discussion where we have an attending moderating a conversation about the topic at hand. We provide you guys with learning material prior to the session for you to review, and then we just jump into review of cases, and you get feedback from the different attendings present at the time. Oftentimes, we have 1 or 2 fellows during the session, and on the other side, we have 5 or 6 attendings providing support and clinical expertise. This year, we're doing something unique in that we have 1 fellow here, and so we combine with our colleagues from the University of Louisville and the University of Kentucky, who also have 1 fellow, to have our didactics together to further make even more robust our attending presence and the ability to have a very meaningful conversation. We're happy with the results, very happy so far. Additionally, of course, there's distinguished lectures, grand rounds, hospital-based didactic activities, and opportunities for you as well during your didactic sessions. One of the requirements will be to have journal clubs, but in addition to that, participate at different tier workshops, do regular didactics while it's spending time at the VA, to present at the Baylor College of Medicine annual review course. There are courses available, either free or sponsored through our grant to enhance your abilities as an educator, your understanding in healthcare management, or as a researcher as well. These are not mandatory, but certainly are nice options. You have the ability to sit into QI-related meetings as the ones discussed here if this is something that is of your interest. There is no mandatory QI project requirement. One thing worth highlighting is through the Craig Nielsen Foundation that funds our fellowship, the ability to have up to $10,000 stipend through them for different things as listed here, primarily the ability to attend at least 2 spinal cord injury related meetings and get support for this, books, online learning, certain equipment, society memberships, etc. There's more than plenty research opportunities I will share. Oftentimes our trainees have more opportunities than they actually have time to spend on. So every now and then they have to actually say no to an opportunity here and there, just based on the volume. But both our fellows presented oral presentations last year at Asia, for example. They both have contributed to writing a chapter with myself. And our current fellow is getting ready to submit abstracts for Asia, for the Asia meeting that will take place in 2025, and a few other projects that she's already spending time on. So opportunity is there. The just as important factor, in my opinion, the mentorship available to make the most of those opportunities are definitely there as well. Program updates, as I mentioned earlier, where we're having 3 months of electives now instead, and some add-ons to our current outpatient clinic menu of options in terms of where to spend time, if you will. In this slide, we can see a list of our recent graduates going all the way back to class of 2020. More recently, Dr. Martinez, who graduated only a few weeks ago. who is joining our faculty starting next month, which we're very happy about. But overall excited about what our graduates are doing. Several of them working in different academic settings as well as other types of settings, but contributing to the field of PM&R and spinal cord injury in general. There are no call responsibilities, and there's a 100% board pass rate for our fellowship. You can look at the policies briefly listed here, and for additional information, feel free to use this link. And to tour our facility, and by that I mean Tier Memorial Hermann, feel free to use this link as well, where you can get a quick glimpse of what our hospital looks like, especially since interviews are being done virtually. Some pictures from some recent graduates at their graduation ceremony. And please feel free to contact us. We will be thrilled to hear from you and thrilled to meet you during the interview process. All the best. Thank you.